to know, because this is what's going on in Congress, what would be the impact if you didn't have Medicaid funding for this clinic, if you didn't have Title X funding? How much do you depend on that, and what would it mean for the women, I guess, and men that you serve?
Well, I can say that funding is absolutely essential for Planned Parenthood patients. About 40% of our patients are Medicaid patients, which means that if Medicaid funding were to go away as a payer source, it would be absolutely, horrible for our patients, for lack of a better word. They wouldn't be able to access their care, and about 4 in 10 patients do use Planned Parenthood as their only source of health care when we've surveyed our patients. So to kind of give you an idea of what kind of an impact that would be from the Medicaid perspective, for Title X, about...
Of course, it's family planning.
Family planning, right. And it offers family planning services to the safety net of the safety net. That's really how we look at it. So people who aren't eligible for Medicaid, who don't have private insurance, undocumented people, or people who have been documented for less than 2 years, so they're not eligible for Medicaid, teens, people who are in relationships with their spouse, so they don't want to access their insurance, domestic violence. And with that funding, it's about $3.1 million here in Illinois. It actually costs us more than that to offer that care, but that's what the subsidy allows us to do, is to provide care to the safety net of the safety net. It allows us to slide down to zero for our reproductive health care, family planning services. So I don't know if anyone has anything else to add, but it would be an incredible loss to our patients. And
well, tell me, what kind of things do people come here for?
So we mainly get, we have Loyola down the street, so we get a lot of students that come in for either STD screening, birth control, because they're not planning a pregnancy anytime soon, they want to finish school. And a lot of our patients, like she said, this is their primary source of healthcare. We'll refer them to primary care providers, and they're like, well, I don't have any, I don't have insurance, this is the only place that I come to. So we want to make sure that we're able to provide services to patients regardless of whether they have insurance or not, and having Title X and Medicaid, or being able to refer somebody to apply for Medicaid is really important for patients who don't have access.
So what about cancer screenings? So do you see people come in, for the regular mammograms, or they're concerned about a lump, or what?
For Pap smear, yes. We refer out for mammograms. We provide Pap smear screening for women. We still, if they're not due for a Pap smear, we still advise them to come in for a pelvic and breast exam annually. We provide birth control services for women.
So you do manual breast exams?
Yes.
Yes. And then you can refer them out?
Yes.
we also do STI testing and treatment, and here in the Chicago area we have one of the highest STI rates in the entire country, and so this is a huge
Explain what that is.
So sexually transmitted infections, we used to call them sexually transmitted diseases or STDs, but we changed the language because so many sexually transmitted infections actually don't present with any symptoms, and so it's a huge problem. It's an especially huge problem here in the city of Chicago and in Cook County, and we have some really robust programs working to educate and test in that space, but the testing that we do in our health centers is incredibly important. We do HIV testing and screenings as well.
Do you have men that come in?
Yes.
Yep.
What do they come for?
Also for STD screening mainly, they come in for either their partner tested positive for an STD, so they're here for treatment, and then we provide a full range of STI screening. So depending on if they're men who have sex with men, then we'll offer additional screening for hepatitis, syphilis, to make sure that we're covering all our bases and making sure that they're also getting screened and fully educated on what their risks are.
So age-wise, I know you're close to the university, so I imagine most of your clients are young, but that's not the only ones, right?
No.
So describe who comes in here.
We have a big range of women in their early 20s to mid to late 30s. We do have women who come in their 40s, and those we also refer for mammograms especially. So we have a full range of patients, not just students.
And we do have a growing male patient population. At this point, we serve about 8% of our patients are men, and we're continuing to see that increase every year.
Interesting.
Yeah. Do you want to talk a little bit about our new services for,
Sure.
especially for transgender patients?
Yeah, so we started offering transgender services September of last year. And this is just providing hormone therapy for patients who are wanting to transition. So I know that our clinicians who provided services, they did training with Howard Brown, which has been providing transgender services for quite some time now. We've had patients that come in that are interested also in the services. So yeah, that's pretty much what we offer for transgender.
Yeah. And we've always offered a full range of reproductive health care for that community, but trying to be, as inclusive as we possibly can be of their full range of needs. Do you want to talk a little bit about the PrEP trainings or the PrEP treatments that we're doing too?
Yeah, I think that, like Katie said, we want to make sure that we are providing comprehensive reproductive health care services and that we do so in a way that it's inclusive of all people. So we recently, a couple of months ago, decided to expand our scope of services in order to provide pre-exposure prophylaxis for HIV. So in short terms, that's just a way to prevent HIV negative people from contracting HIV if they are part of a high risk group.
These are preventive services.
It is.
Correct, so it's preventing for
Correct.
someone becoming positive.
And we provide it at all of our 17 health centers. And in some of our communities, we are the sole provider of PrEP services.
So what does that mean? What do you provide?
So we provide the education, the counseling, and the prescription in order to take the medication that will prevent clients from getting HIV.
Really? I didn't even know that. If you're negative, there's medication you can take?
Yes.
Yes.
I didn't even know that.
It was, the medication is called Truvada. It was approved in 2012, and just like you, there's a lot of providers out there that are not even aware that this kind of medication and treatment it's available.
In many counties in Illinois, Planned Parenthood is the sole provider of PrEP services.
Well, thank you so much. And I want to also thank you for your courage, because I know you're here to provide health care to the community, health care to women in particular, but unfortunately there's a growing threat, as we saw, the horrible act of murder in a Planned Parenthood clinic in Colorado Springs. So I know you're thinking about your job and you're doing your job and you're taking precautions, but it really means a lot to the women of this country. Do you know how many women statewide access Planned Parenthood a year?
Yeah, statewide we have over 60,000 patients accessing our services through over 110,000 patient visits.
And what about here? In this
Here it's about
particular place?
6,500 patients.
Well, thank you. You're doing a great job. Appreciate it.
Thank you.
No,
Thank
and
you.
we thank
Thank
you
you.
because it's champions like you that allow us to continue to do the work that we do. So
Well, it's an
count
honor
with your
to
support.
partner with you on this. So let's do a tour.
Okay,
Yes.
sounds great.